I'm Susan Rachel Condon. I'm a licensed massage therapist, certified nurse midwife, childbirth educator, and mother of 3.
And I'm Richard Condon. I'm a licensed massage therapist, certified rolfer, and father of 3. Out of our personal and professional experiences with pregnancy, we've developed a host of uncomplicated approaches to meet the needs of expectant couples. Augmented with wisdom from other educators, we offer our program of stretching routines, massage techniques, and labor positions to deliver proactive choices into your hands.
We've been teaching hands-on labor support techniques since 1994, and we found that an active approach to pregnancy fosters communication between partners and builds confidence in the natural process of labor and birth.
Use our program as a springboard to discover your own ways of encouraging, supporting, and nurturing.
Sit on a firm surface facing each other with your legs a comfortable distance apart. Sit up tall on your sits bones and keep your spine long. Hold hands and gently circle around your pelvis, keeping both sits bones on the floor at all times. Give each other feedback about how far into the stretch forward you would like your partner to take you. Hold each other's wrists or forearms to go into a deeper stretch. Keep your spine long as you allow your partner to pull you forward. When you lean back, rotate around your hip joints and engage your abdominal muscles as you gently tip your tailbone forward to give extra length to your lower back. You should feel this along the entire length of the back of your body, from your shoulders, back, hips, and thighs to your calves. Grasp each other's wrists or forearms to increase the stretch. Take deep, nourishing breaths in and exhale as you work into the stretch. Cross your arms and take your partner's hand. Reach up to stretch and bend sideways, using your partner's weight for leverage. Try to keep your elbow beside your ear to maximize the stretch, and keep both sits bones down. You should feel this stretch along the side of your rib cage, your hip, and in your shoulder. Exhale as you bend toward the floor. Sit up tall, back to back, maintaining as much contact as you can. Place your hands behind your head and touch your elbows to your partner's to open your chest. Twist from side to side, maintaining contact. Then, hold hands and bend sideways. Try to rest your entire forearm on the floor while keeping both sits bones reaching down into the ground. Next, interlock your forearms. Lean forward to stretch your partner's chest and shoulders. When you are being stretched, let your head gently drop back by allowing your partner to support you fully. Finally, drop your arms and slowly lean forward, completely supporting your partner's weight on your back. Then switch and allow your partner to support you. Concentrate on steady, deep breathing in through your nose and out through your mouth. After stretching, you can relax together and connect with your baby through abdominal massage. Use a small amount of oil. Keeping your entire hand relaxed and in contact with the skin will feel best. Make circles on either side of the abdomen, taking care to avoid the navel, which can be sensitive in late pregnancy. The baby may move in response to being massaged. This is normal. It feels great to give a gentle lift to support the weight of the baby. Set pillows on a table and cover them with a towel to avoid oil staining. When receiving a massage in this position, the mother should feel well supported so she can give her weight to the pillows. Use a small amount of an edible oil warmed in the hands. If the oil can be seen on the skin, you're using too much. Stroke up both sides of the back and maintain contact as you return to the base of the spine. Carry the stroke up the back of the neck with your fingertips, causing a little nod of the head. Describe circles on either side of the back from the center out with your whole hand. Then, continue the stroke using both hands on each side of the back. In order to avoid injury when giving a massage, keep your knees slightly bent and use the floor for leverage so you can lean in to provide enough pressure. Keep your hands flat and soft. Keeping your wrists straight to avoid injury, use the outer edge of both hands, one on either side of the spine, and stroke down toward the pelvis with firm, steady pressure. Lift and knead the muscles at the top of the shoulder. Repeat this on the other side. Rub the scalp all around the ear to alleviate tension in the jaw muscles. Use your knuckles to rub the back of the neck. Brushing your partner's hair can be both nurturing and soothing. Rest your partner's head against your forearm, which should be well supported by pillows. Knead the upper arm with both hands. Sit in a chair facing your partner. Hold her hand with one of yours and use the other hand to apply long open strokes toward the shoulder. Squeeze and knead the hand. Use your fingertips to open and stretch the palm. Squeeze and lengthen each finger. In early labor, contractions are regular, usually last less than a minute, and are roughly 5 to 20 minutes apart. Early labor is usually the longest part of labor. Rest if you're tired, but remain upright and active otherwise. Position changes encourage fetal descent and empower laboring couples. Find a countertop, high-back chair, or mantelpiece to lean on. Keep your feet hip-width apart so you can shift your weight from side to side with your knees gently flexed. You can also circle around your pelvis. This movement provides a focal point for women during contractions, helps the baby to come down, and helps labor progress. Keep breathing steadily in and out. The labor partner stands with one foot in front of the other, bearing weight mostly on the back leg. The laboring woman leans in and against her partner and yields all her weight to gravity. Try to rock and sway slowly if it feels good. If this pose is too strenuous over time, or if the labor partner's back gets tired, leaning against a wall may help. The laboring woman's feet should be hip-width apart, or wider, and her knees should be relaxed so she can give all of her weight to her partner for the duration of the entire contraction. The labor partner's stance is the same as in slow dance, but deeper in a lunge. The laboring woman faces away from her partner and sits as high up on his or her thigh as possible to prevent slipping. She can truly sit down and give all her weight to her partner, who may offer words of encouragement directly in her ear. Like the slow dance, this position can be achieved using a wall for support. To return to standing, the labor partner shifts forward from the back leg to the front. The laboring woman faces the wall, feet hip-width apart, and sits on her partner's thigh, leaning forward with her forearms against the wall. This position provides access for applying back pressure with the forearm. Partners should lean firmly down and against the base of the spine for the entire contraction. At the start of a contraction, lean your back and head against the wall and slowly slide down until your sits bones rest on a stack of firm pillows high enough to support you comfortably in a squatting position. When the contraction subsides, slide back up the wall or have your partner assist you. You can also lean against your seated partner in a supported squat. Elevating your arms expands your rib cage and increases your breathing capacity. Partners can massage the scalp and jaw muscles and offer encouragement. In active labor, contractions are 3 to 5 minutes apart and last at least a minute. Because they are more challenging, positions in which the woman can receive massage and rest between contractions are most beneficial. Try many approaches to find what feels best to you. Sit in a chair behind the laboring woman. Locate the spine. Use the heels of your hands to apply alternating pressure by clasping your hands together and moving down on either side of the bones. Lean in and keep your hands relaxed. Try using the heels of your hands with an open palm. Catwalking between contractions feels good. You can also isolate each side of the spine. Try standing and catwalking with loose fists on particularly tense areas. If your wrists and hands get tired, try using your forearms. Clasp your hands together and move your elbows up and down to lift the muscles and exert compression on either side of the spine. Hold with steady pressure or release and squeeze again. Move from your shoulders so there's less pressure on your wrists. Adjust your chair to face what you're working on and squeeze the muscles around the hips. This feels good between contractions if your partner has been walking or squatting. Some women experience discomfort in the lower back and pelvis during contractions and find relief from counterpressure on the pelvic bones and sacrum. The sacrum is central and close to the surface on the back of the pelvis. Maintain sustained pressure for the duration of the contraction. You may need to change tools, so try soft fists, the heels of your hands, and your forearms. Lean in and down. When active labor is long or tiring, it can be difficult to lie down to rest between contractions. Sitting backward in a chair enables some women to truly sleep during these breaks. Sometimes a hot water bottle on the lower back feels good. Partners can sit in another chair and spoon the laboring woman from behind. When a contraction starts, the partner is in an ideal position to apply counterpressure. After the contraction ends, spoon up and conserve your energy until the next one comes along. When lying down is comfortable, counterpressure can be provided with minimal disturbance. This is a good position for heartening words. Kneel on a pillow on the floor with knees hip-width apart and lean on a pillow in your partner's lap. Your partner can rub your back with palms and loose fists between contractions. Kneeling can help a baby rotate into a favorable position. You can provide catwalking by kneeling behind the laboring woman using flat palms to compress the muscles on either side of the spine. To work more specifically, use the outer edge of your hands with your fingers laced to alternately compress the muscles. To perform lifting and squeezing in this position, clasp your hands together and place the heels of your hands against the edge of the thick bundle of lower back muscles between the top of the pelvis and the bottom of the rib cage. Be sure you are below the ribs, as the last two ribs are not attached in the front and come to a point about 5 inches from the spine. To apply counterpressure from a kneeling position, the pregnant woman leans over a stack of pillows with knees hip-width apart. Her partner kneels on a soft surface, facing her feet, and places a forearm against the sacrum to lean forward and stretch the lower back. As an alternative, place forearms at the top and base of the spine and lean in to lengthen the back. Partners can also kneel behind the mother and lean down with either 1 or 2 forearms. Kneeling gently on her feet may feel good and provide a welcome distraction. Choose the approach which feels best to the laboring woman and hold that position for the entire duration of the contraction. Many women find that the repetitive motion of using a rocking chair or rolling on a physio ball during labor is comforting. Some women like to rock between contractions, and some women rock during them. Circling the pelvis may also feel good. When a baby is not facing her mother's back, the heavy base of her skull presses on nerves in the mother's pelvis, especially during contractions. This may cause painful back labor. While most babies will turn at some point during labor, pelvic movements with the ball's support can help the baby turn to a favorable position sooner. Women who experience severe back labor should kneel and rest on the ball, doing pelvic rocking during contractions to help their babies turn. Counterpressure is often very helpful for women experiencing back labor. The ball can be used to give counterpressure as well. If the labor partner's hands get tired, an invigorating massage can be given by rolling tennis balls on the thick muscle groups of the back, the hips, calves, and on the feet. Compression on the feet using the partner's heels can provide a nice distraction between contractions. Be sure the mother has flexible ankles before attempting this. Finally, a thorough foot massage with some oil or cream is often a welcome distraction before, during, and after labor. Make circles with the heels of your hands around the ankle bones. Milk the foot. Use your thumbs to knead deeply in the arches. Lengthen and squeeze the toes.
Touch modalities are proven to reduce stress and promote kinesthetic and sensory awareness.
Numerous studies have shown that having a nurturing, confident, and skilled labor companion can reduce the duration of labor and the incidence of complications requiring medical intervention.
More important than technique, however, is the continuous presence of an individual devoted to the emotional and physical well-being of the laboring woman.
We hope our program has inspired confidence in your ability to meet the challenges of labor together.